Name?
Okay, my name is Ron Kupsik, and my dog's name is Mishu. I just enjoy people, and I also enjoy making people happy, and I read about it, and I see how it brings joy to people that are in the hospital, and I'd like to be part of it, you know, by bringing them a little happiness for a couple minutes, a visit. The first thing you have to do is you got to get through the temperament test, and that they want to see how, if your dog's aggressive, mean, likes to bark, if he or she spooks easy, or I should say, you know, frightened. And then if you pass that, and they also see how you, as a handler, handle the dog. If you pass that, then you go to a 4-day 10-hour class, and that they show you or test you and show you how to go approach a patient in the bed, in a wheelchair or in a chair. Let the dog get used to the IVs and the different machines and the sounds of the hospital, and it's pretty intensive. 40 hours in 4 days. It's a little wear and tear on the owner and the dog.
Sure. My name is Joseph Solik, and this is my dog Riley, who's pretty interested in the floor right now. Riley, sit. Sit. Good boy. Actually, I have an acquaintance, Ken, who's in the program, Ken in Dakota, and he was the big prime mover for me to get involved with this. He was in the very first group, and I was in the second group, and I shouldn't say this, but since we're being videotaped, I'm a dentist, and Riley comes to the office with me every day, and he actually sits on patients' laps while we work on them. It was actually Ken's pushing, and I always try to look with, I always try to do something I can do that we can do together, and I was fortunate enough to get him in the program, and this is something that he and I can do. And it's also nice. I mean, I walk him a lot. He brings a lot of smiles to people's faces when we walk him. I thought, oh, this would be a pretty good thing. So that's what we're doing.
Name?
Hi, my name is Rick Mayer, and my dog's name is Lily. Saw an ad in the newspaper saying they were looking for dogs, and I had a dog that I thought might be a good match. Called up, they asked me a bunch of questions like, can your dog sit on command? And all my answers were no to their questions, so they told me that I was not a good candidate. So I asked them what could I do to get her in the program, and they suggested I take her for some obedience training. And she was already 5 years old, and I'd never taken her for any training, so I thought, oh, we'll try it. She was pretty feisty. I took her for some obedience training. She took to it right away. Came back for the screening here in the hospital, and she passed. And then we came back for the training, and she got in. We'll be in almost a year. In November, it'll be a year for Lily. 4 to 6 times a month. We're here a good hour and a half to 2 hours.
Okay.
The shift is 2 hours, but we're usually done a little bit before that. On the average, between 10 and 15. Sometimes a lot more than that, though, if the other dogs don't come. If something happens where all the volunteers can't make it. So we may end up with more, sometimes 20, 22. But today I think I did 10. And I'm going to go back and help the other 2 guys that are here.